dedicate these presentations to one person, that is Dr. Dharmbir Singh Sethi. I attended a course organized by him in 1996 at Singapore, cadaver dissection course. I will tell you, that transformed my life. And another person here, Dr. K.R. Megnath, is my ENT hospital. He was my senior resident at PJ Chandigarh, under whom I learnt a lot. I will tell you, I am grateful to these two personalities who helped me to master this endoscopic sinus surgery and also the radiology and progress. Of course, we should remember these two gentlemen. One is Stamberger and his guru, Messer Klinger, who revolutionized endoscopic sinus surgery. So somebody asked me, a question like, the fundamental lamellas of the lateral wall of the nose. Okay, so though they are very very important, and also this dependent a lot on embryology also. The first lamella is the uncinate process. Okay, uncinate process is the first one, the lamella of the uncinate process, and next the bulla lamella. Okay, then next the lamella of the middle turbinate, and lamella of the superior turbinate, and the anterior wall of the sphenoid sinus. Okay, these are the fundamental lamella that we should be able to identify in a sagittal section. Okay, starting from uncinate process, and second the bulla lamella, and the middle turbinate lamella, and the fourth is the superior turbinate lamella, and also the anterior wall of the maxillary sinus, the final one. Okay, this is very important lamella. So these are also, the thickness is actually more thick slides that they have taken. That is 1.5 mm thickness. Okay, and taken at 1 millimeter. This thing. So one thing, whenever you are request for a the sagittal section, you have to ask the radiologist to mark right and left properly. Otherwise, unless there is something, some prominent feature is there, something like a patient nose stud or something, you will not be able to make out which is right, which is left. Okay, it's very confusing on the this thing on the CT scan. Okay, and second thing is always ask for a the CD which you can study on a on a DICOM software, so that will make easy for you. Okay, yeah, that is this thing. So when we go from lateral to medial, so what structures we see? Okay, so it looks little dizzy and confusing and all, but nothing to worry, we'll simplify it for you. Okay, so now what we have here is the anterior cranial fossa. This is the frontal bone and the greater wing of the sphenoid. Then we have the temporal bone here, and that is the temporomandibular joint. This is the condyle of the mandible, and this is the coronoid process. This is the zygomatic process and part of the maxilla bone here. Okay, and this is of the infratemporal fossa. So further going further medially, so we have anticranial fossa, middle cranial fossa, greater wing of the sphenoid, orbital plate of the frontal bone. So this is the zygomatic bone, and also maxillary sinus has started appearing, and the temporal bone here, the mandible has started disappearing. Okay, so they should remember these structures, and this is the infratemporal fossa. So going further medially, so here what we have is again orbital plate of the frontal bone, and the frontal bone here, and the zygomatic bone, frontal process of the zygomatic bone, which is lateral, and the greater wing of the sphenoid, and which forms the floor of the middle cranial fossa, and the temporal bone. This is the tympanic bone, occipital bone, and the mandible here. Okay, and these are the infratemporal fossa. So again, this is the please don't mark on the this thing because it becomes a bit disturbing. How do we undo that? How do we undo that? Can you erase this? Whoever did this, doctor, please can you erase that? Can you remove this? Yeah, you will have to undo it or link and slide. Okay, so let me take laser pointer. Okay, yeah, please, thank you very much. Okay, and this is the maxillary sinus. Okay, and going further. Okay, again the frontal bone, this is the orbital plate of the frontal bone, and this is the greater wing of the sphenoid. The temporal bone, mandible has started appearing. There is a styloid process here. Okay, this is a pre-styloid compartment of the infratemporal fossa, and this is the maxillary sinus. The globe has started appearing. Okay, the orbital cavity. Okay, orbital cavity, frontal bone, floor of the frontal, the roof of the floor of the frontal uh, middle anterior fossa, and this is the middle cranial fossa. Okay, and the temporal bone, infratemporal fossa, the maxillary sinus. Okay, and this is the pterygomaxillary fissure which opens laterally into this thing. That's the pterygomaxillary fissure and infratemporal fossa, and the upper alveolus, and this is the orbital plate of the frontal bone and frontal sinus. So frontal sinus has started appearing here, and this is the roof of the orbit or floor of the anticranial fossa. There's nothing but the orbital plate of the frontal bone, and this is the greater wing of the sphenoid, and this is small foramina here. See, this is easier here. This is the foramen spinosum. Okay, this is this thing, and this is jugular bulb, and this is the ascending portion of the enteral carotid artery, which enters here, to become the geno of the enteral carotid artery, and it enters here anticranial fossa. Okay, and this is the foramen spinosum and the greater wing of the sphenoid. Pneumatization, pterygomaxillary fissure. Okay, yeah, going further. Okay, pterygomaxillary fissure. This is the frontal sinus, frontal bone, and roof of the orbit, floor of the anticranial fossa, middle cranial fossa, greater wing of the sphenoid. Okay, and further medially, what we have little bigger foramina. This is a 1.5 mm thickness. That's why we are jumping too much. Okay, the film's concerned, and this is the foramen oval. It's a bigger foramen through mandibular division of the maxilla, the trigeminal nerve passes. Okay, and this is the pterygomaxillary fissure. Going further medially, so what we have here, okay, this is the frontal sinus, frontal bone, roof of the orbit. Okay, and this is the anticranial fossa. Okay, then we have the greater wing of the sphenoid, and here the maxillary sinus. Okay, maxillary alveolus, and slowly we are coming to, from pterygomaxillary fissure, we are coming here to the pterygopalatal fossa. Yeah, okay, pterygopalatal fossa and supraorbital fissure. Sorry, infraorbital fissure. It's communicate. Yeah, okay, infraorbital fissure, and this looks like this. Still the foramen oval here. Okay, yeah. So further medially, yeah, infraorbital fissure, and this is the pterygopalatal fossa, maxillary sinus, orbital cavity, frontal sinus. Okay, frontal sinus, and the foramen oval has disappeared. Okay, this is the pterygoid process pneumatization. This is the pterygoid process. Okay, and the infratemporal fossa medial portion. Okay, and further medially what we get here, this is the frontal sinus and frontal bone, roof of the orbit. Okay, maxillary sinus, pterygopalatal fossa, and this is the pterygoid pneumatization, greater wing of the sphenoid medial portion, and this is a cavity like same. This is the fossa of the Rosenmuller. Okay, fossa of the Rosenmuller. Yeah, and further medially. Okay, further medially we go the frontal sinus and roof of the orbit, anticlinal process. Okay, and this is the pterygopalatal fossa, which will continue as palatine canals here, passing through the greater palatine, lesser palatine foramina downwards, and this is the pterygoid pneumatization, fossa of Rosenmuller. Okay, further down here, I told you this pterygopalatine fossa inferiorly continues as pterygopalatine canals passing the this thing, greater palatine, lesser palatine nerves and arteries, and superiorly it communicates with the infraorbital fissure here, and supraorbital fissure will be here superiorly. Okay, and this is the pterygoid pneumatization, and this is the fossa of Rosenmuller, and this is the Eustachian tube opening. Okay, this is orbital cavity and the frontal sinus. This is the maxillosinus, medial wall of the maxillosinus. Maybe this may be the attachment of the inferior turbinate. This may be attachment of the superior turbinate. This may be lacrimal canal. Let's see. We go further as we go. We understand this. Yeah, this may be the lacrimal canal. Okay, this is the inferior turbinate. This is the inferior meatus, and this is the middle meatus. Okay, medial wall. Further medial to the nasal. This is nasal cavity. Okay, nasal cavity, and this is the palatine canals. Okay, and this is the eustachian tube, and this is the posterior coena, nasopharynx, and that's where the fossa of the Rosenmuller opens, and this is the in supraorbital fissure with the optic canals. Okay, this is the frontal sinus. Okay, and this is the anticlinal process. Okay, this is the floor of the orbit. Okay, this is almost coming closer to the medial wall of the orbit. Okay, and this is the frontal sinus, anticlinal process. Okay, and this all looks big confusion. The medial wall of the orbit not very clear. Okay, we can say this is the inferior turbinate. This is the horizontal plate of the palatine bone here. Okay, this is the palate, and this is the maxilla with the nasal bones. Okay, frontal process of the maxilla with the nasal bones. Okay, and this is bit looks little jumbled. We'll go further medially and come back. We understand. Okay, yeah, this is sphenoid sinus. Let us come back. Okay, this may be the part of the canal. What is that? Pterygoid canal through the Vidian now pass the Vidian canal. Okay, which was projecting into, if you remember axial and coronal section, it was projecting into it. Okay, this is the optic now. Okay, this is the optic now. Further we come back. Yeah, that was the Vidian canal. Okay, Vidian canal, and this is the optic now. Okay, and this is the superior recti muscle maybe. Okay, yeah, we'll go further. This is the optic now. Okay, sphenoid sinus, posterior ethmoid sinus. This seems to be attachment of the middle turbinate. Okay, middle turbinate, and yes, this is the bulla. This is the attachment of the middle turbinate. Okay, this is all the attachment of the middle turbinate. So this is the basal lamella. Okay, the uncinate will be here. Okay, and this is the bulla, and this is the basal lamella. Okay, the posterior ethmoidal cells and sphenoid cells, and this is the sphenoethmoides. And as we had seen in the axial and coronal sections, this is clival pneumatization is also there, and this is the optic now, and this is the sella. Okay, so for the going further medially, okay, slowly we are approaching the nasal septum on a sagittal section. Okay, this is the nasal bones, and this is the beak of the nose. Agar nasal cells are seen here. Okay, and this is the frontal sinus, and this is the bulla, and this may be the frontal recess area. Okay, this is the attachment of the middle turbinate. Okay, this is the basal lamella. Okay, and this is the sphenoid sinus. This thing is there. Okay, this is the optic apex area on this side. Okay, we are going slowly nearing the post septum. This is the nasal septum. Since maybe little bit tilted, we don't see this thing, complete septum in one piece here. Okay, yeah, we don't see this, the frontal recess. Agar necessary still in this side. Okay, I don't know, right side or left side, I can't make out this. Yeah, okay, it's going right to left. Okay, I'm on the right side, I'm going towards the left side. It is marked here. Okay, good. I'm on the right side going on to the left side. Okay, and this is the foramen magnum and the clival bone, and part which is part of the occipital bone. Okay, this is all the nasopharynx. Okay, yeah. And yes, that was the nasal septum. This is all the vomerine bone, perpendicular plate of the ethmoid. Because of asymmetry, we don't see in continuity. This is the cartilage septum, and this is the sella. Okay, sella, and this is the sphenoid sinus. This is the frontal sinus, and maybe this is supraorbital ethmoidal cellar, part of the frontal sinus only. Okay, frontal sinus. We have gone further towards the left side, still septum, and the sphenoid sinus. Okay, and this is again the part of the frontal sinuses, and again, now we are on the opposite side. On the left side, the turbinates have started appearing. Okay, and the sella, sphenoid sinus. Okay, we go further towards the left side, the frontal sinuses, and the inferior turbinate and middle turbinate attachments have started appearing, and this is the sphenoid sinus. Sphenoid ostium is seen on the opposite side, and this is the sella and the clival pneumatization. Okay, and yeah, this is what middle turbinate attachment, you can see it's going and attaching to the skull base as well as lamina propria. This is the bulla, this is the uncinate, not uncinate, this is the agar nasal cell, and this is the beak of the nose. You need to understand. Okay, yeah, this is the agar nasal cell, this is the frontal sinus, the frontal recess area actually. Okay, and this is the this going attack going to the skull base, and this lamella is the bulla, and this is the attachment of the middle turbinate. Okay, middle turbinate has varying and multiple attachments, as we can see here, and seen part of the uncinate process here. Okay, and the agarnase has started appearing, and you can see this is the frontal recess. Okay, so we have written a paper. It's likely to be published soon. So I have designed something called FR line. So what you do is, so this is to a line drawn from here, the superior portion of the frontal sinus to the posterior edge of the this thing, uh, the bony palate here. Draw a line called frontal recess line. So any cells which are there anterior to that, the frontal cells above the agarnase here, posteriorly they are the skull base cells, supraorbital cells, and other cells. I will come to that later when we deal with anatomical variations and frontal sinus this thing. So here the opposite side, the fossa of Rosenmuller has started appearing. Okay, and this is the optic apex, that is the intercalated artery as well as the optic nerve here. Okay, and yeah, that was the optic nerve, and this is the intercalated artery. This are the sphenoid sinus, and opposite palatovaginal canal or the Vidian canal has started appearing. Okay, and this is the inferior turbinate attachment. This may be middle turbinate attachment. Okay, the bulla attachment, and this is middle turbinate attachment and the sphenoid sinus. Okay, and this is the frontal sinus. Extensive frontal sinus. This is the medial wall of the opposite maxillary sinus. Okay, so we are almost nearing the opposite maxillary sinus medial wall. The sphenoid sinus, this is the optic now. This is the fossa of Rosenmuller. This is the opposite this thing, what the eustachian tube, and this is the left side, the spinopalatal foramen, and as well as the palatine canals, greater lesser palatine now passes. So opposite the pterygopalatine fossa, palatine canals, and the pterygoid this thing, pneumatization, fossa of Rosenmuller, eustachian tube, and the opposite maxillary sinus, orbital cavities, senior and the frontal sinus. Okay, and the supraorbital fissure, and this is infraorbital fissure, pterygopalatine fossa, palatine canals. Okay, this is the pterygoid process with pneumatization, and this is the maxillary sinus and the frontal sinus. Okay, frontal sinus. Okay, and the supraorbital fissure, and this is infraorbital fissure, and this is the foramen rotundum. So we didn't appreciate the foramen rotundum well there. We'll try to go back and see palatine canal and pterygomaxillary, the pterygopalatine fossa. Okay, yeah, and pterygoid process with pneumatization. Okay, and this is the orbit and orbital apex. Okay, and slowly we are going to the other side towards the opposite side, and this is the frontal sinus, roof of the orbit, anticlinal process, and maxillary sinus and pterygopalatine fossa. Okay, going almost to the other extreme, and this is the pterygoid process, and this is the pterygomaxillary fissure, maybe. Yeah, pterygomaxillary fissure opening into the infratemporal fossa other side. Okay, yeah, pterygomaxillary fissure. Okay, we are going to the opposite side now. The middle cranial fossa, anticlinal fossa, orbital cavity, orbital apex, and maxillary sinus. Okay, and this is the foramen ovale. Okay, and if we go for the lateral, we should see another small foramen. This is the foramen spinosum and this thing. Okay, foramen ovale and foramen spinosum, and see that this is intercalated artery and jugular bulb here. Okay, and this is the temporal bone, middle cranial fossa, and this is orbital cavity and anticlinal fossa, middle cranial fossa, and this is the pterygomaxillary fissure. Okay, pterygomaxillary fissure. Further laterally we going, pterygomaxillary fissure, orbital cavity, frontal, middle cranial fossa. Okay, jugular bulb here. Okay, and infratemporal fossa. Okay, infratemporal fossa, and the tympanic bone. This is styloid bone. Okay, and this is the this is lateral rectus coming from skull base here, greater the sphenoid. This is the lateral rectus muscle. Okay, lateral rectus muscles maxillary sinus stopped appearing. Okay, and that's about, yeah, these pictures will be labeled pictures, will be these are part of the book. It will be available to you on the app. Okay, all parts are labeled like this. Okay, keep visiting the this thing, the app regularly to get to study that. Okay, And let me see foramen rotundum. I didn't notice on the opposite side. Yeah, this is the foramen rotundum. It's here, foramen rotundum on the right side, okay, and foramen rotundum, yeah, on the left side, okay. So this is, see, the foramen rotundum is different from the optic canal, okay, where the optic nerve passes through, into the intercranial cavity. That is just below that, this thing will be there, okay. Yeah, optic strut, below this optic strut bone it will be there, okay. So this is about the sagittal sections. Anything you didn't understand? Yeah, we'll have a quick question answer session on sagittal sections, okay. Yeah, okay. Yeah, yeah, majority of the pictures we already labeled, so we are still in labeling process, okay. I'm giving a color coding depending on whether it's a bone, vessel, and this thing, okay. It will make your life easy for you to understand that, okay. Osteometal unit in this thing, osteometal unit in a this thing. I will let me see whether we can see the osteometal unit. Yeah, this is osteometal unit, okay. It's difficult to see that this thing. So all this, okay, where the frontal sinus drains, okay, where the middle meatus is there, and also maxillary sinus is there. All this is the osteometal unit. It's difficult to see in one section, okay. Yeah, see the middle turbinate, okay. This is the middle meatus. This is where the frontal is also draining, and also further go, you see the maxillary sinus is also draining. So this is a maxillary sinus ostium appears to be. I hope so. Yes, that's the maxillary sinus ostium. Difficult to say this thing, okay. Yeah. Pneumatization of sphenoid sinus, pre-stellate compartment. I'll come to that first. Okay, pre-stellate and then the pneumatization of the sphenoid sinus. See, stellate process you need to identify, okay. So this is the stellate process, okay. How do we say stellate process? It is, see, you identify the temporal bone, okay. From temporal bone, this is the tympanic portion of temporal bone, and further medial to it you can see stellate process going down. This is stellate process, and this is all the pre-stellate compartment of the infratemporal fossa, okay. Posterior to that is the post-stellate compartment, okay. This is a stellate process, yeah. So basically what we have in the pre-stellate compartment is the muscles of the mastication and the fat and the vessel, mainly the internal maxillary artery and those things, and the the splenius, and so many muscles are there. The vertebral muscles, all those, they come in the pre-stellate compartment, okay. That is the thing. And the pneumatization of the sphenoid can have wide pneumatization, okay. We saw that sphenoid, okay. Yeah, this sphenoid, yeah, this is the sphenoid at the septum level. This is the basis sphenoid, and this is the clivus bone, okay. It can that, and also it can pneumatize this is the pterygoid process. It can pneumatize that, and also we